Ever heard of a serious complication from diabetes that can lead to a coma? In this video, we will discuss details about diabetic ketoacidosis, its causes, signs, etc. What is ketoacidosis? Ketosis is a normal process where the body uses fat for energy, producing ketones without harmful acidity if insulin works properly. In diabetic ketoacidosis, rapid ketone buildup acidifies the blood, posing a life-threatening risk. Proper insulin control can prevent diabetic ketoacidosis. Signs of diabetic ketoacidosis. Diabetes ketoacidosis symptoms may arise fast and be your first indicator of diabetes. Ketone levels rise with blood sugar above 250 mmol/dl. You may use the bathroom more, have a terrible headache, and become dehydrated. If you don't receive aid, you may feel nauseous or vomit, have weak muscles, a dry mouth and skin, become confused, have hot skin, fruit-smelling breath, stomach pain, and quick or hard breathing. Without immediate treatment, diabetic ketoacidosis can be fatal. Causes of diabetic ketoacidosis. Number 4. Lack of insulin. A serious lack of insulin is the main reason for diabetic ketoacidosis. If your cells don't have enough insulin, they use fat for energy instead of blood sugar. Number 3. When diabetes is diagnosed. People who have just been told they have diabetes or don't know they do are more likely to get diabetic ketoacidosis. They have a higher chance of getting ketoacidosis because they don't know how to control their insulin levels or check their blood sugar levels. Number 2. Method of giving. Insulin. The risk of diabetic ketoacidosis is affected by the method of giving insulin. People who use insulin pumps are usually less at risk than people who use insulin shots. But insulin may not be given properly if pumps aren't working right or if infusion sets get blocked. This can make insulin levels unstable, which raises the risk of diabetic ketoacidosis. Number 1. Expired insulin. Using old or damaged insulin can make it less effective, which can make it impossible to control blood sugar levels. This makes it hard to keep blood sugar levels in check and maintain the balance needed to avoid ketone buildup, which raises the risk of diabetic ketoacidosis. Other things that contributed. Number 7. Stress and illness. When you're sick or worried, your body releases stress hormones like adrenaline and cortisol. These hormones mess with insulin and cause your blood sugar to rise. Number 6. Infections. Some diseases, like pneumonia and urinary tract infections, can raise your blood sugar, which can lead to diabetic ketoacidosis if you don't take care of it. Number 5. Injury or surgery. Injuries and surgeries can cause a stress reaction in the body, which releases hormones that mess up insulin's work and could cause ketones to build up. Number 4. Heart attacks, strokes, and clots. Heart attacks, strokes, and blood clots can all affect blood flow and put a lot of stress on the body. Number 3. Pancreatitis. Inflammation of the pancreas can be a sign of diabetic ketoacidosis and a risk factor for it. It often comes with serious abdominal pain and stops the body from making insulin, which makes blood sugar problems worse. Number 2. Pregnancy. During pregnancy, changes in hormones can make insulin less effective. Number 1. Drugs, alcohol, and some medications. Some medications, drugs, and alcohol can make you more likely to get diabetic ketoacidosis. Some mental drugs, corticosteroids, and diuretics can interact badly with insulin. If you want to know the 7 diabetic ketoacidosis symptoms that diabetics ignore, then go to the link in the description and watch our complete video. Risk factors of diabetic ketoacidosis. Number 4. Age. Your age is a big risk factor. People over 65 who have diabetes are more likely to have complications, such as diabetic ketoacidosis, which is usually worse because of other health problems that come with getting older. Also, kids younger than 5 are more likely to get it, and girls who were born female are more likely to get it around puberty. Diabetes treatment that works well is important for people of both ages to lower these risks. Number 3, getting insulin. A big risk factor is not being able to get insulin easily. Because insulin is so expensive, many people with diabetes can't afford to take enough of it, so they skip doses or take less. This makes it hard to control blood sugar, which raises the risk of developing diabetic ketoacidosis. Number 2, not getting meals. If you skip meals or eat at odd times, your body may burn fat for energy to make up for it. This makes the body make ketones quickly, which raises the risk of diabetic ketoacidosis. Eating at the same time every day helps keep blood sugar levels steady and lowers the body's reliance on fat burning for power. Number 1, a history of diabetes or autoimmune diseases in the family. If you have a family history of diabetes or autoimmune diseases, you may be more likely to get type 1 diabetes, even if it hasn't been identified yet. If type 1 diabetes isn't found early, it often leads to diabetic ketoacidosis because the body can't make enough insulin. Diabetic ketoacidosis is a serious problem that can happen if you have diabetes. It happens when your body doesn't have enough insulin, which makes it break down fat quickly for energy and build up dangerous ketones. Your blood will be very acidic and have a lot of sugar because of this process. To manage and avoid diabetic ketoacidosis, it is important to know what causes it, what its symptoms are, and what factors put people at risk. Don't forget to read, share, and